I can start with my experience in the robotic surgery exactly many years ago. And at a certain point I noticed that the clinical results, especially for radical prostatectomy or partial nephrectomy, could be improved a lot. And so this is the reason why I try to expand more and more. And now I perform more than 5,000 procedures. So I did more than 4,000 radical prostatectomy. I think that as a single surgeon, and I think that we can expand this technology because I had the lucky to work with different type of robotic platforms, from the first platform up to the XI, that is the last. And so I had the opportunity to see and to test how the technology improve our abilities and our capabilities to obtain the best results in our patients. I am a surgeon that I lived the open surgery period. After I switched from open surgery to laparoscopic approach, but it's as a natural progression, I switched at the end to robotic surgery. And so when I decided to switch from laparoscopy to robotics, well, it is for me very easy because I had already a good experience with the laparoscopic approach. And so in a very short time, it means after only few procedures, I had good results in terms of operative time, in terms of blood loss, etc. And so this giving me the opportunity to improve, to increase the quality of my surgery. So why it is important to have a good mentor, especially in the open surgery, as well as in laparoscopy? Because now we are living the last step of surgery, but sometimes you need to go back to laparoscopy because you are not able to do to use the robotic surgery, but you need to maintain the capability to offer the mini-invasive approach for patients. There are some cases that cannot be treated with robotic surgery, but as well cannot be treated with laparoscopy. And so we need to do it with open surgery. So it's important to have a global experience. Don't forget that when you do mini-invasive approach, with the mini-invasive approach, they can be more effective only if you are sure that if you have a complication, you are able to treat them. In my strategy as well, when I teach them what I have to do, for example, in order to increase the abilities and the capability to mature in terms of surgeons, I say them that it's not important to become a super skills in robotic surgery, but first of all, they need to be clinicians. So it's important to know exactly the first the indication for the patients, because you need to select very well the indication. And when you do the perfect indication, you have made the 90% of your procedures, because if the indication is not correct, obviously you can have a complication. The patients, they can have dangers for them. So moreover, I give them the possibilities to attend in many operative rooms that I have in my centers. So the operative rooms in which we do open surgery, the operative rooms in which we do laparoscopy, and as well the robotic surgery, because they need to have an overview at 360 degrees. And after they become mature on this point of view, they can select what is the best field for them. For example, the 3D modeling in order to planning the procedures, to do the planning of the surgery. Yes, it's very important to share ideas and to share as well to discuss about the clinical cases, to share as well the opinion, the philosophy that we applied in your practice. So I think that what is happening now, that there are a lot of surgeons that they focused their attention, especially in one single technique and as well in one single pathologist. So I think that this is correct, because this is one modalities to obtain the best results in our patients. But don't forget that this cannot work alone, but you need to work in one team, because someone or other surgeons, they need to support him in some difficult steps. I visited many men on institutions. Exactly, I think 7 years ago, he invited me, he invited the professor. And so I visited him, this is his institution. I had the privilege to visit as well his house, where he invited to take the tea. And so for me has been a very important step. Many Menon obviously was one of the most important surgeons in the world, because he had the opportunity, he offered us the opportunity to change the philosophy concerning the management, the treatment of the prostate cancer, and he expanded a lot and offered many opportunities for surgeons, for as well for patients, to offer now the best treatment with the surgery when there is the indication. We can navigate inside the organ, and as you can see, we can establish it, we can remove the surface of the kidney, and you can analyze the details of the vasculatures. I want to send a message, if it's possible, for the next future. We need to treat the patients the best way, but I think that we need to do research at the same time. So the research should be based only in the clinical analysis of our results, because it's important that our 2 or 3 months is important to see, to establish what is your results. When you do one procedure, a certain numbers of procedures, in order to change your technique to improve step by step. And so in my experience, there are some procedures in which you don't finish your learning curve, like for example radical prostatectomy. So I change every day, and I continue to improve my surgery with the improvement as well of the results, because I test my technique. And so I think that we don't reach always the best aim, because the best aim is only a virtual aim.